If you're an older man and you masturbate, I need to ask you something important. Have you ever quietly wondered, is this still healthy after 50, 60, or even 70? Or maybe you've worried in private, am I hurting myself? Am I weakening my prostate or making things worse down there? If so, you're not alone. This is one of the most common yet rarely spoken questions I hear from men in their later years. And the truth is, there's a lot of confusion out there. Some say it's dangerous, some say it's essential. Most men are simply left in the dark. That's why today we're going to break the silence. I'm Dr. Sophia. I've been a practicing urologist for over 10 years, and I've helped thousands of men navigate not just their sexual health, but their dignity, their confidence, and their quality of life. And in this video, we're going to have the conversation most men never get to have, but absolutely deserve. I'll walk you through 10 surprising benefits of masturbation as an older man, and then just as importantly, 10 risks and mistakes you must avoid to make sure it stays a healthy practice. One of these risks in particular might shock you, but if you understand it, you'll protect not just your prostate, but your long-term vitality. Before we dive in, do me a favor. Hit that like button to let YouTube know this is an important conversation, and leave a quick comment telling me where you're watching from. I always love seeing the community of men from all over the world connecting here. And of course, don't forget to subscribe so you don't miss any of our upcoming health conversations. All right, let's start with the good news. Here's the truth. Masturbation does not automatically damage your body, weaken your performance, or shorten your lifespan. In fact, for many men, it can be part of a healthy routine when it's done consciously and in moderation. The real issue isn't whether you masturbate, it's how you do it, how often, and whether it's serving your health or slowly stealing from it. That's what most men don't realize, and that's why understanding both the benefits and the risks is so important. So, let's talk science. This isn't about myths, locker room jokes, or old-fashioned shame. This is about what decades of research in urology, endocrinology, and psychology have taught us about the male body as it ages. From Harvard studies on prostate health to European research on hormone regulation to clinical observations of men in their 60s, 70s, and beyond, the evidence is clear. Masturbation has both powerful benefits and potential pitfalls, and when you understand both sides, you can use it as a tool to protect your health rather than accidentally harm it. So, let's go step by step. Benefit number 1, it maintains penile health. Think of erections like exercise for your body. When you achieve one, blood flows into the spongy chambers of the penis, the corpora cavernosa. That blood carries oxygen and nutrients, keeping tissues elastic and healthy. Without regular erections, tissues can stiffen, and over time it becomes harder to achieve firmness. Masturbation acts like a workout for this vital system. Benefit number 2, it promotes prostate health. This is huge. Multiple studies, including a landmark Harvard study, show that regular ejaculation helps flush the prostate. That means secretions, toxins, and dead cells don't build up, lowering your risk of both enlargement symptoms and even prostate cancer. Benefit number 3, it strengthens your pelvic floor. Every orgasm involves rhythmic contractions of the pelvic muscles, especially the pubococcygeus. Strong pelvic muscles mean better erectile control, better bladder control, and even less risk of leakage or incontinence later in life. Benefit number 4, it lowers cortisol, the stress hormone. We live in a stressful world. Masturbation triggers a sharp drop in cortisol, the hormone that raises blood pressure, increases anxiety, and strains your heart. In other words, it's nature's built-in stress relief. Benefit number 5, it releases a cocktail of feel-good chemicals. Dopamine, oxytocin, endorphins. These brain chemicals surge after orgasm. That's why many men feel calm, connected, and even joyful afterward. For older men, These neurochemical boosts can help combat loneliness, depression, and low motivation. Benefit number 6, it improves self-awareness and detection. By regularly touching your body, you learn what's normal and what's not. Many men first detect issues like testicular lumps, Peyronie's disease, or unusual swelling during self-pleasure. Early detection saves lives. Benefit number 7, it improves sleep. After orgasm, your body releases prolactin and oxytocin, hormones that relax you and make sleep deeper and more restorative. For men who struggle with insomnia, this can be a surprisingly powerful tool. Benefit number 8, it improves pelvic blood circulation. Beyond erections, the increased blood flow benefits your prostate, bladder, and surrounding muscles. Poor circulation leads to stagnation, which can worsen urinary symptoms. This habit keeps things moving. Benefit number 9, it can train ejaculatory control. Through conscious techniques like the stop-start method, masturbation gives men a private way to practice control. For those dealing with premature ejaculation, this can translate into more confidence with a partner. Benefit number 10, it keeps desire and neural pathways alive. The brain is the ultimate sex organ. By engaging in sexual fantasy and stimulation, you keep the neural circuits of desire active. This protects libido and prevents the use it or lose it effect many men experience. So, there's the good news. But as with any tool, how you use it makes all the difference. Let's talk about the 10 risks you need to avoid. Risk number 1, social isolation. When masturbation replaces human connection rather than complementing it, men risk withdrawing from relationships. Remember, pleasure is healthiest when it adds to life, not when it walls you off. Risk number 2, skin microlesions. Too much friction or no lubrication can cause tiny tears in penile skin. These can irritate, inflame, or even allow infection. The fix, be gentle and use a good water-based lubricant. Risk number 3, desensitization. Always using the same pressure or grip conditions your brain to only respond that way over time. Arousal with a partner may become difficult. Solution, vary your technique. Risk number 4, masking erectile dysfunction. Some men can only get firm during masturbation, not with a partner. That's not normal aging. It's often a warning sign of heart disease, diabetes, or low testosterone. If you notice this, see your doctor. Risk number 5, nerve compression from poor posture. Sitting hunched in a chair for long sessions can compress the pudendal nerve, leading to numbness or pain. Lie back comfortably or switch positions. Risk number 6, emotional escape mechanism. If masturbation is your only way to cope with stress, loneliness, or boredom, it can become a crutch. Build other coping tools, exercise, friends, meditation. Risk number 7, guilt and shame. Many older men carry childhood messages that this is dirty or wrong. That guilt can eat away at confidence and joy. If that's you, consider talking with a sex-positive therapist to reframe it as the natural, healthy act it truly is. Risk number 8, pelvic congestion. Yes, too little ejaculation can hurt the prostate, but too much, multiple times daily for long stretches, can cause aching, heaviness, or even fatigue. The answer, listen to your body, moderation is key. Risk number 9, reduced semen quality. If trying for children, most older men aren't trying to conceive, but if our daily ejaculation can reduce sperm concentration. For fertility, the sweet spot is every 2 to 5 days. Risk number 10, disconnect from reality via pornography. When the brain is overstimulated by extreme online porn, it can distort expectations. Real intimacy may feel less satisfying. If you use porn, balance it with imagination, memory, and real connection. So, what's the takeaway? Simple, masturbation after 60 is not inherently good or bad, it's a tool. When used consciously with moderation and variety, it can support your prostate, protect your erections, lower stress, and even help you sleep. But when it becomes compulsive, isolating, or physically careless, it can do the opposite. Here's what I recommend as a healthy baseline. Aim for moderation. 2 to 4 times a week is a healthy range for most men. Use lubrication and vary your technique. Pay attention to your body. Aches, numbness, or changes in arousal are signals, not inconveniences. And above all, remember this is about enhancing life, not replacing it. I know this can feel like a vulnerable topic. Many men have never had an honest, shame-free conversation about it in their entire lives, but let me reassure you, there is nothing wrong with taking care of your body this way. In fact, done consciously, it can be one of the simplest, most private forms of self-care available to you. You don't need to feel guilty, you don't need to feel too old, and you certainly don't need to suffer in silence. So if you take just one message from today, let it be this. At any age, even in your 60s, 70s, or beyond, you are not past your prime. You are not broken. Your body still has pathways to pleasure, vitality, and strength. And when you treat those pathways with respect, they will continue serving you for years to come. Gentle changes, conscious choices, and a little awareness can bring back freedom, dignity, and confidence you thought were gone. If this video helped you, please like it. Subscribe for more practical, science-based health advice, and share it with a friend who might need this conversation but is too shy to ask. And now I'd love to hear from you. What was the most surprising thing you learned today? Drop it in the comments. I read every single one. I'm Dr. Nora HAYES, reminding you your age does not define your vitality. Small, conscious habits can protect not just your prostate, but your quality of life. Stay strong, stay hopeful, and I'll see you in the next video.